counties. I pledge
allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Very good. Miss Teresa, do a roll call, please.
Commissioner Hoffmaster,
Here.
Commissioner Houts, Commissioner Leininger,
Here.
Commissioner Schaefer,
Here.
Commissioner Collins,
Here.
Commissioner Stoll.
Present.
All right. Thank you very much for that. Next on the agenda, approval of the agenda.
I would move to approve the agenda as presented.
I'll support that.
We have a motion and support. Further discussion? All in favor with an eye?
Aye.
Opposed, the same. Motion carries. Next, all important officer elections. Do we have any nominations for chair?
Commissioner,
Yes,
if I may.
you may.
I would move to put into nomination for the position of chairperson from the great county of Branch, Mr. Tim Stoll.
All right, we have a nomination for Tim Stoll.
I'll support that.
We have support.
And as a reminder for Commissioner Collins and I know Commissioner Schaefer's been here on the Board of Health before, and for any of those in the public who are here and those watching, we take a rotational basis here on the Board of Health. Branch County last year had the vice chair position. So this year, their representative will be moving to the chairman position. So.
Yep, very good. Any other nominations? All right, we'll close the floor to nominations. Commissioner Stoll has been nominated as chair. All in favor with an eye?
Aye.
Opposed, the same. Congratulations, my friend.
Thank you.
I'll let you take over. I don't know how you want to do it.
Just hanging the gavel and the.
Yeah, that might be easy.
I was using it as a coaster earlier. So
Look at that. Prepared with
yeah, I know, right?
beauty 10 card and everything. Well, I appreciate you mentioning actually the reason why that happens. It's not just because I showed up
You're the
all of a sudden.
new guy.
Such it is.
Right, by default, right?
You're the one from Branch County of the Tears.
Right.
All right. So you want me to just handle it from here, right? So
You
Floor is yours.
Next up is our vice chair election, officer elections. And as Commissioner Leininger mentioned, it moves to, I believe, Hillsdale County. Is it Hillsdale County as the vice chair? So I would open up the floor to nominations for vice chair.
I support it.
Well, he nominates me.
I support that nomination.
Push for support. Any other nominations? Do I have to say that 3 times?
No.
There.
No.
Sorry. Good. All right. Any discussion on that? Hearing none. All those in favor, say aye.
Aye.
Any opposed? All right. Mr. Leininger, sorry.
Yeah,
you're-
we have a vice chair,
Yep.
and we have a placard ready.
So next week, you guys will switch places.
Awesome.
We'll let you sit there for now.
Thank you.
I don't have to sit up there, Jared. I'm fine.
Okay.
All right. So we're up to committee assignments. And without having a lot of experience with this, is this a board? Does the board kind of discuss this together? Is it a committee chairperson responsibility?
Bylaws
Is
in
it-
here.
They are in there.
It's from page 119 of our packet, and it's the bylaws on it. Starts the bylaws. And committee assignments are Commissioner, our Mr. Chair are highlighted there in the bylaws.
Does the chair appoint?
That's my question.
The
That's
board
my
chairperson,
only
with
question.
approval of the board, shall appoint a representative from each county to the finance committee and the program policy and appeals committee.
Okay, sounds good.
If you see on page 3, they have last year's listed. Yep. Go
I
ahead.
did. So, as far as 2025 committee appointments, my appointment would be that we keep Commissioner Outs, Commissioner Hoffmaster on finance. Commissioner Collins, I would also appoint you unless you have a strong preference against that. All right, and then the Program Policy and Appeals Committee, include myself, Commissioner Leininger, and Mr. Schaefer, Commissioner Schaefer from St. Joe County.
I would ask Commissioner if you would make sure to designate the chairperson of each of those committees for reporting purposes and conducting those meetings.
Okay, so program policy and appeals would be Commissioner Leninger.
Yep,
Okay,
I can,
yeah.
yep,
Okay.
yep, I can be chair for the
Sounds
budget
good.
finance, yep.
Thanks for that reminder.
And again, for the bylaws, I would move to approve those appointments as presented by the chairperson.
Okay.
Second.
All right, we have a motion with support. Is there any discussion on that?
Second.
Okay.
Nope, we're
All
good.
right, hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. All right, so we're finally up to approval of the minutes from December 12th, 2024. And I don't remember this meeting at all, so.
I would move to approve the minutes of the December 12th, 2024 Board of Health meeting as presented.
Support.
You
Yeah, we're the only ones that were there.
All right, we have a motion with support.
I don't know if you're right or not.
Is there any discussion on that? All right, hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. Okay, so we're up to we just do one public comment period, up to the public comment period. If there's any,
Commissioner, we do, if you review the agenda, we do have two public
well,
comments.
I was just looking at it
At
actually.
the top of the back side of that page, of the
Okay,
top of the
Gotcha.
second page,
All right.
the second one. And our rules for public comment are posted there on the right side of the agenda.
In the
in the box on the front page.
if there's anybody that would like to address the board, please stand up and give us your name. All right, so hearing none, we'll move on to the health officer report.
Good morning.
Good morning.
So page 7, and I'll just go through and highlight some of this. So I did want to welcome our new board members. As we were as I was putting this together, we weren't quite certain yet who our St. Joseph County commissioners were. So welcome to Commissioner Schaefer, and of course, welcome back to Commissioner Huffmaster. Here in Hillsdale, of course, Commissioner Leininger. Welcome to Commissioner Collins. And in Branch County, welcome Commissioner Stoll, and we're happy to have Commissioner Houts back, who's enjoying sunny weather somewhere while we're all cold. So our Board of Health schedule for 2025 was approved at the December meeting. It is provided today again for discussion, and so we'll get to that. The Board of Health schedule does include opportunities for board education. Today is the first board education day, and that occurs directly after the conclusion of the meeting. So, and I get the pleasure of leading that today. So we'll get to that as soon as the meeting has concluded. The bylaws are reviewed annually, and they are, of course, in the packet today. There is a recommendation for a change by the Program Policy and Appeals Committee. As outlined in the bylaws, the amendments must be submitted in writing to all members at least 10 days prior to the meeting. So these will go to the February meeting for a vote. Personnel policy updates. So the agency has a personnel policy committee. The personnel policies govern how we interact with our staff and tells our staff how we expect that they will conduct business here at the health department as a staff member. The committee is made up of one representative and one alternate from each office, the health officer and the administrative services director. So there's 6 members, and then myself and Teresa would make it 8. We meet with them at least once or twice a year, more often if there are things that come up. And at the meeting today, there is a proposal for a potential change to the personnel policies that would align with the sick leave change should it go into effect on February 21st. So we know that there's some legislative action at the state. Perhaps it might not actually happen, but that is before you today because our next full board meeting isn't until the 27th of February, which would be after the implementation date. So the information that we have in the personnel policies was reviewed by our attorney, Andrew Breggy is his name. And so we feel that it's okay for your action today. And we did leave out my last sentence there. We're holding that back for more information. Employee recognition. So every year we take in January the opportunity to recognize those staff members who have certain years of service. So 5, 10, 15, et cetera, et cetera. So this year, 5 years of service, we recognize Josh Engelhart, who's a health educator, works out of our Coldwater office. Annalisa Rice, who's a sanitarian in our Hillsdale office. Lisa Palmer, who is a nurse in our Hillsdale office. Joe Frazier, who is recognized for 20 years of service. Joe started with us when he was just a baby. And is now
Youngest for a long time.
yeah. So and now is our environmental health director.
How old when you started, Joe?
25. And my hair was one color. It's one
Why?
color now. It's just, it wasn't what it was originally.
Different.
Great.
Yeah. Teresa Fisher, who's been with us for 25 years. Teresa also started with us when she was a baby, right? Yeah. I'm at 30 years this year. And then Lee Zimmerman, who's a sanitarian in our Three Rivers office for 35 years. So I'm going to pass these in your direction.
You just send these now or wait till the end of the meeting?
And there's also a letter that needs to be signed from the chair. and vice chair.
All right, sounds good.
Thank you, ma'am.
All right, so
Will you? You have a pen that you sign with?
I do.
Is there a magic pen?
It's a magic pen. It's just a all right, so that's employee recognitions. We are going to be doing a public launch of our environmental health application portal in the next few weeks. We had shared that new application opportunity to residents at the December meeting. Basically, people can go online now and apply for a well permit, septic permit, or a food license. So we'll do some of that demonstration later today. Staffing update, we have a couple of positions that are open. We are seeking an RN to staff our mobile unit, and the Area Agency on Aging is seeking an RN care consultant.
I thought we had that mobile unit staffed at our last.
No, well, I'm trying to think when we did have it staffed, and we had another RN job internally that individual decided to take. So she is now a children's special health care nurse. So it is respiratory virus season. Michigan is currently ranked high for respiratory illnesses. I did provide the map there. It's in color, so you can get a feel for how high is and what the other colors are. In early December, we were in the green area, so low, and now we are kind of in the midst of respiratory virus season. So it is not too late to get vaccinations to help prevent or minimize symptoms from respiratory illnesses. We want to continue to encourage those influenza, COVID, RSV, and now pneumonia as well for those that qualify. So public health concerns I wanted to bring up. One is, of course, the very cold temperatures. In all three of our counties, there were opportunities for people to take shelter if they needed it. And that was advertised, of course, on our social media sites and others. So, of course, the most concerning thing is the carbon monoxide poisoning, which there were a couple of individuals here in Branch County who were found deceased and may have been from carbon monoxide poisoning. So we try to message on all of that. Be careful of the use of generators, ensure that you have a carbon monoxide detector, because it happens every year, unfortunately. Pertussis, or whooping cough, is we're seeing continued cases of that. It is a vaccine preventable disease. It is quite dangerous to infants. And we do see more pertussis due to a declining childhood immunization rate. That's leaving more infants and children at risk. So we want to encourage folks to take advantage of vaccines that they are eligible to receive. And finally, bird flu or highly pathogenic avian influenza. In Michigan in January, we've had additional poultry flocks that have tested positive for HPAI. When that occurs, the flocks are depopulated or culled. In other words, they're all killed, right?
Eliminated.
Eliminated. And that's why our chicken is so expensive and why our eggs are so expensive.
Oh, it's not the only reason why eggs are expensive. There is another major reason why eggs are expensive. But
Okay,
we won't go into that.
okay, all right. So
Contributes.
it does contribute to it, of course, and poultry don't do well when they get bird flu. Most of the flock dies anyway. And then we've also seen bird flu get into dairy farms. Luckily, in dairy farms, the cattle recover usually, but we do take those cattle out of milk production, so that can have an impact on our milk. But something we're definitely paying attention to. We've been talking about HPAI now for quite a while, more than a year. And we want to continue to use biosecurity measures with our own flocks. And of course, our farmers are certainly using those to defend their flocks and their populations of animals. So I try every month to also give you an update on what's going on in our buildings. Our full water office, we have a lease with the County of Branch for this building. And here we are going to be receiving an HVAC upgrade to this building. The determination was made to wait until spring due to, of course, winter weather. And so that should be happening here in the next few months. We have been working with the county to improve the infrastructure of the restrooms and that work, as well as the clinic counter. Some of those surfaces are in pretty well-used condition, and it is time for replacement. Those upgrades will also occur during 2025. So. Hillsdale office. So our building in Hillsdale is owned by the County of Hillsdale. We also have a lease for that building. We are responsible for the maintenance of that building entirely. The repairs to the Hillsdale building's lower level were needed as a result of water damage, and that has been completed. So I also recently had a contractor out, the same contractor that we worked with that did the exterior of our Three Rivers building, to come out and take a look at the exterior of the Hillsdale building so that we can start to talk about changing out the wood surfaces that are on the exterior of that building to a more maintenance-free product. So we're just getting started on that. In Sturgis, we had a floor, that is a space that we rent from a private landlord over in the Sturgis area. We had a floor that needed to be repaired, and that's been repaired. And Three Rivers, the County of St. Joseph owns the building. We have a lease with the County of St. Joseph. Electric and plumbing repairs were mentioned in my December report. Those have all been completed. And we are going to be working on gathering quotes for painting and new carpet at this location, just as we did in our Hillsdale location, page 24. We are going to be working on that in the Three Rivers location for 2025, and that will be paid out of our infrastructure grant funds. So.
A reminder, Becca, one more time. So the lease for Hillsdale and Three Rivers that's $1, right?
It is
And then-
$1 a year.
And then the Board of Health is responsible for all maintenance in both
Yeah.
buildings?
Board of Health is responsible for insurance, maintenance, upkeep
Of both
of
buildings?
both buildings.
100%, right?
Right.
Almost of it.
Yeah, 100%.
Yeah.
We are lucky in that sometimes our Hillsdale County Maintenance will be our contractor.
Yeah.
We still pay for their services. And Three Rivers, we don't have county maintenance or access to it.
Yeah.
So we have to find contractors for that building. It's a little more difficult, but certainly doable.
Is the Sturgis building Growthheiser, or is that long?
It is not Growthheiser anymore. It is Maple Crest. So the location with let's see, there's a Dollar General, My Community Dental Centers is in there. Kind of Frank's and,
It is, it's that rental, equipment rental place is right in front there on 12. Yeah.
maybe.
It's lease
Yeah.
payment on Sturgis. How much do you pay in lease for Sturgis?
Teresa would know.
Get it right.
We just, and was it 23 that we increased the amount of space that we occupied there?
I think it was 23.
23 or we did that, not sure, so that was 24. But somewhere in there, we did take a little bit more space in that building.
Yeah.
Mhm.
One-
Current monthly rent is $1,265.08.
One comment I would say about this building is it appears that at some point in time out in front, there's a brick
Sign,
that there used to be a sign there.
yes. Mhm.
That sign on the north side of the building is pathetic compared to the signage that we have in our other building. So I'm gonna put it on the Bryan County Commissioners. We need a health department sign back at that brick building over here. And I even would question whether we take down the do not enter sign here on the south side of the building to make that a two-way.
I've wondered about traffic flow too. I mean, in my vast experience on the Board of Health.
Today,
Yeah.
for the record.
Yeah.
Now he was here for a committee meeting on it.
Two. Okay, you're right.
But yeah, that's, I mean, signage is something we could explore. I figure, you probably want a lot of input in that, I would think. But
We've had conversations about that sign, and at the time we had conversations about it, the county was working on the other sign that's over on Keith Wilhelm Drive. And so it was indicated to me that this brick structure was going to be removed. And of course, that hasn't happened. But I think we would certainly be open to exploring options for getting signage back in that brick structure. Yeah.
Okay.
Yep.
I'll check that out.
And for those commissioners that Mr. Schaefer may know that, Goldie may know that from Branch County. We rent the space here from the county, but any of that maintenance work, we also pay
60%.
60% of that cost up. I will say as a Board of Health member, I don't want to pay 60% to remove that brick structure out front. I want to use that brick structure and put a sign in it.
That would make the most sense if it's there,
Seems
yeah.
like it.
All right.
Okay, that was my report. Thank you.
Thank you for your report. Appreciate that. And certainly in recognizing those employees too, and yourself. Excellent work.
2 years. Oh my gosh. It was just yesterday.
All right, sounds good. All right, we're up to medical director's report.
Yes, Dr. Luparello is at a conference that is for ophthalmologists, which is what she is by, that's her day job. Yeah, her profession is as an ophthalmologist. So he recorded her report and we are going to play it. Do we have the TVs ready to go, Justin? All right, and Chris is going to control that. She really felt bad that there's 3 of you that are new and she doesn't get to meet you today in person. So she really wanted to do this.
Okay.
So here we go. Here she is. Maybe.
She looks happy.
Mhm.
Good morning. Thank you for the opportunity to record my board. I will be away at the time of the board meeting and an ophthalmology meeting, and I wanted the opportunity for the new board members to put with a face. So, my name is Karen Luparello. I'm the medical director at Bryan County Health Department for 3 years now. I appreciated the opportunity to get master's in during the first 2 years of my work there. My master's is in public health, of course, and I also served as a pediatric ophthalmologist in Hillstone, Michigan. So my board report is usually a small report of what I've done for the month and also some educational materials. So the report is in your packet labeled January 2025. And of course, we're always watching the numbers of communicable diseases, especially respiratory diseases at this time of the year. So we do have a very high rate of flu, COVID, and RSV, respiratory syncytial virus, which will be the topic for my educational course. If you look at number 5, continue to treat multiple latent tuberculosis patients and active tuberculosis patients. So the board knows this requires direct observation therapy, which is called POT. So our nurses will call or FaceTime those patients to watch them take their medication. Sometimes we even go to their homes. So this is pretty labor intensive. And then we're also working on the winter provider newsletter. This goes out to all of our students in our Tri-County area every quarter. So I'll move on to my report on respiratory syncytial virus, which is pretty timely again, because this is the season for high respiratory syncytial virus rate. This morning, I also got a call from Hillsdale Hospital stating that they're restricting their visitors to their OB unit, mostly because of the rate of RSV on. So RSV, or respiratory syncytial virus, is a common respiratory virus. And it affects your nose, your throat, your lungs. It typically causes very mild cold-like symptoms. So most of us might not even know that we have RSV. It's usually spread, as I said, in the fall and winter, along with other respiratory viruses. So it gets tough to separate those symptoms from maybe the flu or COVID. And it peaks in December to mid-February. And it spreads from infected people coughing or sneezing, direct contact with someone who has RSV, or touching a contaminated surface. Most people will get RSV and then or a child. And almost all the children will have RSV before their second birthday. So again, we might not even know it. We might just think that they have a common cold. Some people with RSV contagious for about 3 to 8 days. It can be contagious a day or two before they even get symptoms. So that's dangerous because they could be spreading it and not even know. And people with weakened immune systems can spread the virus for 4 weeks or longer. So even more concerning. Infants and older adults are most likely to get severe RSV and require hospitalization. So adults with chronic illnesses are those that we worry about for RSV, like cardiovascular disease, chronic lung disease, renal failure, complicated diabetes, neurologic or neuromuscular conditions can't clear their respiratory secretions, chronic acute metabolic conditions, and the significant obesity, and also living in a nursing home. You can see that those are really close quarters to the. You can do laboratory work to confirm RSV. So the statistics are that 2.1 outpatient visits per year in children under the age of 5 are due to RSV. About 58,000 to 80,000 hospitalizations occur in that age group as well every year. And 100,000 to 150,000 hospitalizations occur in adults 60. The CDC recommends immunization some young children and older adults. And those recommendations have even changed for the older adults very recently as of June. So the map is a monoclonal antibody. It's not a vaccine. That is used to prevent RSV in infants. It's recommended for infants and against some young children. Administration of that usually through state. We do have some state where the season for RSV varies. It is recommended also for kids 8 through 19 months with chronic lung disease, immunocompromised, cystic fibrosis, and interestingly, American Indian or Alaskan Native. So those individuals should be given the monoclonal antibody. Early data shows that this monoclonal antibody is at least 80 to 90% effective in preventing babies from being hospitalized. So very important. Pregnant women should receive maternal RSV vaccine during weeks 32 through 36 of their pregnancy to prevent their baby from contracting severe RSV. So the CDC also recommends a single dose RSV vaccine for all adults, and it's not a 75 older, and 60 to 74 if you were at increased risk of RSV. And again, as I said earlier, as of June, that was gone down to 50. So if you were at an increased risk for severe RSV, you for getting a vaccine, even if you are 50 to 59 and older, and definitely if you're 65, even without any immunocompromise. So if you've already had a vaccine, that vaccine is good for approximately 2 years, and you should talk to your provider about when to get your next vaccine. So just a topic, very important this time of the year, respiratory syncytial virus. You'll hear terms RSV, you'll hear all sorts of advertising about the vaccinations. If you have any questions about when you should be vaccinated, if you should be vaccinated, you can always call our health department. We have very knowledgeable to help you determine when and if you should get what vaccine. And so normally at this point, take some questions. If you have any questions, please feel free to pass them along via my email, cell phone, and Rebecca or anyone at the health department will have that information. I look forward to meeting everyone in person at the February board meeting. And again, I appreciate the opportunity to record this. So the board meeting time, I will be in DC at an ophthalmology meeting, so I hope it's not too cold there. Thank you.
She just had to throw that.
Now, if you want something interesting from Dr. Luparello, was it November, December of last year? She went through it and read her poem,
Yes. Yeah.
report in poem form, so yeah, very.
She's creative as well
Yes.
as scientific.
Oh, good.
One thing, if you could pass it on to Dr. Luparello, that I've heard from some concerned parents in Hillsdale recently. And these parents are having trouble finding a pediatric physician to treat their children because of their desire and their belief not to have their children immunized. Now, to me, it seems counterproductive to just completely refuse treatment to a child because of differences in opinion between the provider and the parents. And, you know, when they lose all medical care, that's worse on society than them actually having those checkups and things that the parent wants them to have, but the doctor refusing to treat them as a patient because they won't be immunized for the doctor's desire.
We'll bring it up. She does interact with other providers in Hillsdale and may have an opportunity to talk with that doc, but I think also just, letting having some conversations with the hospitals about, what kind of care can these families receive.
Yeah,
Might
but
be good.
that's a more expensive kind of care as
Right,
well.
but the hospital is always looking for providers. And I don't know if the pediatrician that's over there now works for the hospital or if they have their own private practice.
There are a couple of pediatricians. There are 2 or 3 pediatrician practices.
The primary one is private practice. I don't believe they're.
Not affiliated.
Well, I mean, they work with they have privileges at the hospital, but I don't think they're an employee of the hospital.
Well, we'll certainly pass that along.
On a springboard note, what Brent has indicated, I'm a provider of Amish care in St. Joseph County. And I'm wondering if maybe one of the goals in the future could be some sort of an in-service programming at their community center, maybe dovetailing with what some of the things that Chris is working on relative to safety. And then maybe we can have the doctor talk about this particular topic, but what I found is that the Amish are pretty, at least in my community, open to at least education.
Commissioner, what part of St. Joe County are you from?
Three Rivers area.
The beautiful city of Three Rivers. Yeah.
There you go.
Okay, any other questions? Comments? All right, we'll move along on our agenda here. We're up to departmental reports. We have our health, education, and promotion.
Good morning.
Morning.
Good morning.
Chris Dewey,
Supervisor for Health Education and Nutrition and the Public Information Officer for those board members who are new. It's a pleasure to meet you. Included in your packet is a report from our department. As Commissioner Schaefer mentioned, we do have a grant with the Office of Highway Safety and Planning. We are on target with our deliverables. We have met with bishops in all 3 counties. A number of bishops that we worked with in December are in the report for you. It was a very good conversation, very well received. Had a lot of good interaction in regards to some of the things that the bishops are seeing. They were very open and honest about having the issue is a two-way issue, that it's not just the English drivers, but there's also some things that the Amish community could be doing to improve safety on our roads. So we were very encouraged by that. We received a Ohio Department of Transportation had done a study with a survey tool on Amish road usage, and we were able to work with OVC to get that survey. We've revised it for our area. It's been approved by OHSP, and the bishops are willing to distribute it to their congregations and collect it back for us from their congregants. And so that probably will start in hopefully this month, early next month, and we'll have that survey data. That data includes what modes of transportation are they using. We're including a map of the area in which the population is centered and asking them to tell us, like, what roads do you use most? What are the dangerous intersections that you experience, or dangerous stretches of road? And we can share that information with our partners in law enforcement and the road commissions and see if we can work together to come up with some safety strategies. We've had the pleasure of meeting with Sheriff Spence and Sheriff Blankenship, our 2 new sheriffs, and they have committed to the project as well and will continue to work with us. Today we have started working with driver's education programs in the 3 counties to develop some additional materials to help enhance the vulnerable populations section of the education, to include a little bit more information about driving in areas of the Amish community and how to be safe and be alert to areas where you may encounter horse and buggy traffic. And we are also working with part of the advisory group, specifically the sheriffs and some of the road commission individuals. We've obtained a copy of a road safety manual produced by Pennsylvania Department of Transportation. And it has like the road signage, suggestions on where to be on the road, and some road rules and road use language in it. And so we're reviewing that material and making sure that it meets the laws and rules for the state of Michigan. And then we will work with OHSP to get that approved and published as well. We also came across a buggy driver's instructional workbook. And so we'll be presenting that to the Amish bishops to see if that might be a resource that they would want to use in educating their young drivers on how to properly drive a buggy.
Is that from Pennsylvania or from
That's what I wondered
Indiana?
too. Who did it?
I actually found it on a website of a publishing house that publishes Amish material. So I'm really not sure exactly where it didn't come from a DOT perspective. It came from a Amish community. This is how we drive appropriately perspective. So we'll take it to our next meeting with the bishops and see what their opinion of the booklet is, and if they have an interest in it and would like to teach it in a curriculum either through their schoolhouses or from the bishop's perspective, you know, we might be able to look at supporting it that way. So it's moving forward. We're on track. And the Office of Highway Safety and Planning is very pleased. We should see, I'm hopeful that we'll start seeing the advertising campaign here probably in another month or so. They're just finalizing the campaign itself, and it's very exciting. So, Beacon Health, as you're aware, we had a grant with Beacon Health that's getting wrapped up. It has some good results. A portion of that grant was to provide Pivotal with funding to do some advertising, and they purchased a wrap for the bus and, a bus wrap for St. Joe County Transportation Authority. They also did some additional promotion and of their programs to the community. They did some streaming services and did some advertising through Hulu and Spotify and those types of things. We also did the same, promoting our WIC program and our immunization programs. Those streaming services and marketing campaigns through Facebook and social media had 210,000 impressions and 53,000 individuals reached. And we did see an increase in our program participation for WIC in October and November, which was good. The medical marijuana grant applications are completed, submitted, and we are just waiting the award letters for that grant. We've already begun planning on that grant, and we're putting together our strategies to support that grant.
Chris, if I may on that.
Yes.
It's been some of those grant dollars, I think, in the past that have paid for the wraps on the buses here in Branch County, correct?
Branch and St. Joe. The
In
past
St.
few
Joe.
years.
And Hillsdale County, we don't have countywide transportation. The city of Hillsdale Dial-A-Ride, I did hear that they're looking to do some advertising, fundraising there in the city. So I don't know if that would potentially be a possibility
Yeah.
in Hillsdale County now with some of those funds, to see if we could put a wrap on one of their vehicles. Something
So,
to consider.
right. So last year, you may remember that we partnered with the dispensaries in the 3 counties to increase the number of safe storage bills we made available to the consumers. We also partnered with the community mental health authorities in all 3 counties, the sheriff's departments, school districts, libraries. So we had a whole group of partners, and we went from distributing 500 safe storage devices to 1,100 safe storage devices. Now, in order for us to continue at that pace and increase, we've had to look at what things make the most sense financially. And so I'm not confident that we're going to do bus wraps this year, so that we can do more investment into safe storage. While the bus wraps give us visibility, what we're trying to do is keep those products out of the hands of the little ones. And so stay in our team's opinion, investing in safe storage, continuing to increase the number of dispensaries that work with us is our priority. So,
Makes sense.
but sure, thank you for that information, because that could be a possibility for us to look at that, right, as that opportunity.
They're not dispensaries though, they're retailers, because they're not dealing in medical marijuana. They're
Well, some of them are still. So we have some that are dispensaries and we have some that are retail locations. And we actually, last year, we had, we've had more, locations, marijuana retail and dispensary locations reach out to us wanting to be involved for this coming year than we had last year. So that's encouraging to us as well. January is Radon Awareness Month, and so you'll find a YouTube video that was completed by Joe Frazier and Kyle Moore from our BH department, and the link is there for you. Rebecca and I did Hillsdale Facebook Live, and we did their radio broadcast since we last met, and so the link for you to look at that is available to you as well. The community health worker program continues. We still have the one community health worker, and they are still spending 2 days a week at Covered Bridge to support the services at the federally qualified healthcare center. But we are continuing to explore opportunities. The grant funding for that program is anticipated to be expended probably at the end of this fiscal year. So we continue to look for opportunities to maintain that program. We are continuing to bill to Medicaid, Medicare for services rendered. We do not charge any of the participants, but that's still a work in process. So, greatest areas of need that we are working with clients through are Medicaid applications, insurance options, assistance with home repairs, homelessness and risk of homelessness, and finding financial resources. So we have people who do not have any kind of income, so we're trying to help them identify financial resources. And that is my report.
Questions?
I don't have a question, but I do have a comment. I'm very proud of our team for doing the highway safety with the Amish. I think that's really neat that you're meeting them where they're at. And that's just a really good service that we offer that we definitely should be publicizing. It's a good deal. And thank you for that.
Thank you. Yeah, we just want to ensure that this is our goal with this is to work together as a community.
Yeah.
And find ways to be safe for all parties involved. It's not to try to change anyone. It's just to try to respect both cultures and raise awareness
Yes.
to the struggles. Like I said, I'm excited about the media campaign. It's a 400 versus 1. So a car has 400 horsepower and buggy has 1.
Yes.
So that will be the theme. Or there's another theme, but it's a similar theme of, just sharing the roadway and protecting each other.
Unfortunately, I wasn't able to make that December meeting. But if you would please keep me informed of when those Hillsdale County meetings are with those bishops. Some of my relationships there, I'd like to maybe try and get involved with some of that as well, so.
Certainly.
All right, other questions? All right, thanks, Chris. Appreciate it. On to environmental health.
Good morning. My name is Joe Frazier. I'm the EH director. So I'll inform you with some of the stuff that we've got going on in environmental health. We've had a ton of change of ownerships and new restaurants come in and across all 3 counties. But I wanted to highlight one that was kind of special for me because El Canando Mexican cuisine, they came in, wanted to start a restaurant, didn't have the money to go brick and mortar. They started with what we call an STFU, Special Transitory Food Unit. They started small and built, and they really were very diligent about going about it, looking at how to design, and I worked with them to get all the things they had to have in that little food truck, right? And business boom. They were living their dream. It's a little family unit that's doing this, brother-in-laws and brother. So they got that to grow. They bought another unit. So they had 2 STFUs operating within Branch County, doing gangbuster business. And their dream was always, Joe, we want to go brick and mortar. Joe, we want to go brick and mortar. I'm like, guys, keep working hard. Keep working hard. It'll happen. And it did. So they went into the old JT's here in Coldwater, and they worked very, very hard and put all that effort into it. And it's a success story that we in environmental health and public health get to be a part of, to show that we can help partner with the community and grow a dream. And it was just, man, they were in tears. It was great. So I just wanted to highlight that's some of what our staff does here at the health department and in environmental health. So kind of cool thing.
Yeah.
And from what I understand, it's lined up out the door. So try it for lunch, dinner, but that's what we've got going on in the food section. Dee Anderson, our new food supervisor, taking over for me, is going to be going and doing food code training, food law training next week in Kalamazoo. So that'll be great for her. Well, and septic, some pools. We've had a lot of training, more training up at MSU. We sent most of our staff to the groundwater conference or wastewater conference there. That was great because there's installers and regulators at the same meeting. And so they kind of get to pick each other's brains like, well, how does this work? Would you guys do? What do you see? What are the problems? So that's really neat to be able to have industry and regulators together and come on some common ground. We have Jordan Panera, say her last name right, has started as our type 2 coordinator. She just graduated and middle to end of December. It started with us. So she's a Western grad. She's in the type 2 water supply position in St. Joe County. January, I think we've said a couple times, is Radon Awareness Month. Kyle and I did a really cool YouTube video with the help of Josh, who does great work. We sat down and had a nice little conversation for folks to kind of make them aware of what's going on and the resources we have in environmental health, which are, you can come on in and get free radon test kits in any of our 3 offices plus Sturgis to be able to go home and test at your home to see what your levels are. They're very simple. They're not much bigger than a cell phone, just a charcoal test kit. You set it about chest height for 4 days, package it all up, it's pre-posted, put your name and address on it, and off it goes. Number 4 and above is not acceptable, 4 and below is. I did a radio spot yesterday with Doug Spade, the local Buzz radio. I think it's an internet-based radio.
Talkback?
Yeah.
It's,
Hillsdale with talkback?
yeah, it's 102.5.
Oh, it's actually,
State,
yeah,
they're kind of Lenawee, Hillsdale.
I mean, they're headquartered in Adrian. It would be former House Representative member Doug Spade.
Go ahead. We had a nice little conversation with him yesterday. That'll air on Saturday. Just kind of, because it crosses over into Lenawee, we kind of shared a little bit of what they do so that, we're all on the same team, just trying to help people out. So did that. I think that went very well. Good. I'm gonna listen on Saturday. See how I sound.
You have to.
I don't want to. I am, it's that note, I am going to Communication 101 training.
That's what came out of that.
So just, Becky was like, hey, you should do this. And then this came out. And I was like, definitely. I know I'm going to sound stupid. So I'm looking forward to doing that training myself. You're just doing a lot of great things in EH. I'm pleased to be able to be here and present this to you. If you have any questions, please let me know, and I'd love to talk to you afterwards.
Sure. Any questions? Don't be overcritical of yourself, really. I hate how I sound. I didn't know what it is. So.
It's one of those things,
Yeah.
They have edited.
Thank goodness.
Wasn't nice at all.
My dad always told me, "You gotta fix the radio."
All right. Any other questions? Yeah. All right. So we're gonna move on to the agency on aging.
Good morning.
Good morning.
Welcome, new commissioners. Glad to have you. Some of you are familiar with what the Aging Network in Michigan is and does. I'm sure we'll have some board education at some point with you scheduled in the future. But we are the regional administrative and planning agency that serves Branch and St. Joseph counties. We're all numbered in terms of regions around the state of Michigan, and we are Region 3C, Charlie. So we're a little unique. We only serve Branch and St. Joseph counties. Hillsdale is served by Region 2, or Wellwise, as their new name is indicated. We're unique in that we're housed within public health. So we've been effective and efficient for a number of years, nearly 30 years now, and have a great collaboration with local public health being housed here in the building. We also have a special grant called Services to Victims of Elder Abuse. We've held that grant, was competitive back in 2018. And so we have 2 dedicated staff that serve victims of elder abuse, neglect, and or exploitation. They can also be younger than 60 and rely on others for their care. But we have a first quarter report included in my report to you today that sort of summarizes the activities and the scope of what they're working with individuals. And it's very intensive work. And again, it's very unique. Not every area agency on aging has this grant. So we're grateful to do the work, and we have great elder abuse prevention and awareness activities that go on in each county every month. So I summarized the efforts and included that first quarter report for this victim assistance program, and we continue to see a lot of homelessness. We can confer a lot with health education and the community health workers that, and I'm sure you see individuals out and about in the community that look like they potentially could be at risk of or don't have housing. And that's especially concerning as in St. Joseph County, we have a couple of different options for warming centers and or shelter. Here in Branch, it's a little bit more limited, but we do optimize referrals to those organizations. We had a contract review last year and it's considered complete now, so that feels really good. Some of the final bits of work there were contained in the agency's personnel policies. So we're in good standing and look forward to maybe us applying again to continue this work, as we've heard rumblings that they may rebid the grant. So we're keeping our nose to the grindstone, and staff are quite busy. I did put a couple legislative updates that we've talked about over the past, probably year, really. There are a couple packages of bills that have been kind of hot topics for the Aging Network. They did not go through during lame duck, so they'll have to be brought up again if the new legislature wants to move forward with those guardianship and or some vulnerable adult related bills. We are still looking for a full-time nurse care consultant. We just got another interview scheduled, so I remain hopeful there. We are grateful for, again, being a part of public health, because we're able to leverage some support on the clinic side of the world in the agency to help support our participants that have a lot of clinical needs. We're done with programmatic reporting, working on year-end reporting, working on getting all the first quarter data in, now that the state's sort of data warehouse is opened for the new fiscal year. So we just keep chipping away at that. And then the project at the bottom there, number 5, is the No Wrong Door project. That was a new sort of initiative that the Bureau put out to anybody in the state. There were 18 applications that were submitted, we found out. And we collaboratively went in on a proposal with our other area agency friends in Kalamazoo, Calhoun-Berry, and then our region, as well as our friends at the Disability Network of Southwest Michigan, to do long-term care supports, options counseling, they call it. So when people are in a grip about what options might be available to them, whether it's public funded or private, we can help navigate and offer them information and resources to make an informed decision moving forward, as well as this sort of a new way of administering the state health insurance program. So we haven't heard anything. We hope to by the end of this month, and I'll certainly keep more updated on this. If you have any questions, I'd be happy to answer if I can.
Questions?
With a lot of your funding coming through the Older Americans Act, and with some of the executive orders issued by President Trump this week, what are we doing to make sure that we're compliant with those? I know we've done a lot of work here in the past on the DEI initiative that was instituted underneath the former administration, that's now barred underneath President Trump. Are we making sure that we're removing that from all of our contract language and documentation?
So the state, the Aging Community Living Supports Bureau is working with a nationwide organization to look at Older Americans Act compliance, because there's a reauthorization that's abuzz and sort of in process right now, which is our governing legislation. And so we will wait for that guidance and those compliance items to come down from the Bureau, because they have to go through not only the state of Michigan's Older Michiganians Act rules, but also the federal Act. And so that's an in-process thing, and will take months and months and months.
But the state doesn't get to put guidelines on distribution of the federal funds. They can only dictate distributions of state funds, not federal funds.
They do that through the interstate funding formula, which is both of those pools of funding that go through the Michigan Commission on Services to the Aging.
Close to the same office, right?
Correct, through the
It does, but
ACLS.
it comes underneath the federal rule.
Well, we're certainly, and I think all agencies are going to be paying attention to changes, and we will certainly rely from the public health side from our partners at the state office to help clarify, provide direction about things that we need to take action on as well. So.
All right, other questions? I had one. So the No Wrong Door, so the application that got submitted through PureWell, it sounds like, you probably had to define a geographic area that would cover, right?
Correct. We had to narrate sort of how we were going to handle referrals, especially they were most interested in referrals. And those would go to one central location, and then depending on zip code and where they were, maybe according to north part of the county, south part of the county, and capacity of all 3 individual regions, as well as if they were a person with a disability, we would sort of navigate that and work to make it the most efficient referral possible. So
Sure. My question also was kind of around though, if our application is denied, that we don't get it, would there be another application that went in from a different region that could potentially cover our area?
that is a potential.
Okay.
That is potential.
We don't know though.
We just
Right,
don't-
I understand that.
we
I'm
just
looking
don't know.
for a little bit here, but
Yeah,
so. Okay, yeah, I
When will the
understand.
determination be made?
they're hoping by the 20, I believe it's the 29th was published in the grant funding document.
So another week.
So it's a few days away, and
Yeah, I imagine it's a little tenuous, right?
it is. I mean, that we have wonderful related to the state health insurance program in both counties. We have great local providers and local partners that have very highly trained volunteers to help people navigate Medicare, Medicaid, and our supplemental insurance and our Part D plans. And we just want to keep it as is, as close as we possibly can, so that those folks who are so invested can remain invested. And
Sure.
we shall see.
Will the ombudsman play a part of this at all, or is it completely separate?
No, it's separate from the long-term care ombudsman program. Correct.
Will we need any additional staffing if we receive that grant funding?
Yes, we will.
Had meetings this weekend at Pope Petty in Brooklyn because of the application submitted there.
Sure.
And I think the training on that is even sometime in February or early March, so.
That's correct. They expect us to jump when they say jump, and
Quick
we'll
rollout.
do our best to make sure we land on 2 feet and have viable, well-intentioned and great candidates to do this work. I mean,
Commissioner, I serve on the Wellwise board, so,
Okay.
the Region 2 area on aging, and there we're looking at granting authority to post and hire additional staff. If we get granted the award now, even though we don't know that we're gonna get the award, so that they have those staff
Ready.
in line to go to the training.
There, that would
Yeah.
make recruitment a little difficult, yeah.
so we're looking at
The unknown.
utilizing our existing outreach specialist job description and have enhanced some of the language to comply with the forthcoming rules that we'll have to follow. We had to submit a proposal without knowing the playbook, so we're all a
I
little
think
bit.
everybody did.
Yes,
Yeah.
that is correct. That is correct. So
I'll reach out, Commissioner Stoll, if it comes to pass and you need to look at additional staffing.
Sure. Understand. All right. Thank you, Laura. All right, personal health and disease prevention.
Is Heidi Hazel, and Heidi is at ICS 400 today. If you guys aren't familiar with Incident Command System training, our staff, because we are a first responder for public health emergencies, we get to train up on that stuff. So
Sure.
her report is in your packet. It's pretty self-explanatory, but I did want to point out one thing. So on page 38, under Children's Special Healthcare Services, you might want to bring this back to your communities. The Family Center for Children and Youth with Special Healthcare Needs is once again accepting applications for camp scholarships. So it is that time of year, and wanted to point that out. We would, want all kids to have the opportunity to take advantage of going to camp if that's what they'd like to do. So.
Is this a specific camp?
So, as much as I know. So,
That's just interesting. I didn't know that we did this.
yeah, I think it's just part, I think it's always been part of the Family Center.
Okay.
The Family Center does quite a lot of, additional things, so. Terry Penny and Heidi would know a lot more.
Sure.
And our new nurse, in CSHCS, her name is Amanda Opaki. Did I say that right? So, yeah, so I did want to point that out. The rest of Heidi's report contains statistics with regards to communicable diseases, immunizations, WIC numbers. So I can try to answer questions if you have them, or we can share information on Heidi's email, and you can send any directly to them if you'd like.
I noticed here that you had a new technician for Branch County for hearing vision. Where are we at in rotating through the school district and getting that training done? And what age groups do we do?
Hearing and vision or
Yeah.
COLA?
Hearing
And vision. I can't completely answer that question because I don't work in that. Does anybody here know exactly what age groups we do? Okay. So, by the way, let me introduce Tina. I keep looking kind of in her direction. Tina is one of our nurses. She is a public health nurse in our Three Rivers office. She is working on her BSN, and one of the things that she needs to do is shadow an administrative. So we talked, and she thought this would be a great opportunity to get a feel for what the administrative side of public health does. So
I bring that up. My wife mentioned something about one of our kids the other day. I think they've just acquired the male gene of selective hearing, but
well, I can get that information for you guys. At this point in the year, I would guess that our techs are well beyond halfway. But I would need to check with Terry, who is the supervisor for our technicians, to make sure. So
I'm pretty sure that like one or the other of them has to be done first, and it has to be done by the end of. If I don't, and then the other. I know we do those.
and before we get out of the department reports, and Joe, and got to ask you about this in your report. The legislation that was pending last year did not pass, correct? For the statewide septic code.
It did not. It did not. There were several different bills that they tried to pass, and none of them gained any traction. Senator Singh, I think, is looking to possibly reintroduce that, but we have not heard where we are along that path yet.
there were a number of food bills, and I think that's what you were mentioning. So there was on-site sewage, there was a whole bunch of food bills as well, and none of those ended up
Yeah.
getting any traction.
On the food side of it, there's talk that they want to go to the 22 food code instead of the 17 because it takes so long to implement that across the state that by the time we get the 17 implemented, it's already, it could be 10 years old, you know, so it's like, okay, so.
The proposal in 24 was to adopt the 17 code.
Right.
So now that didn't pass, they are going to take a look at
Potentially.
other food code options. And I think it makes sense to look at some of the newer information and to go backwards.
Absolutely.
Right. So.
Okay. So, any other questions yet? Good. All right, financial reports.
Good morning. Welcome, everyone. It is very nice to meet you. As Becky said, I am Teresa Fisher, and the Administrative Services Director, and I'm kind of a junker for the health department. So anything that doesn't really belong to Joe or Heidi or Laura comes in my direction. So I oversee finance, IT, HR, all those things that really don't belong to one thing. So we did hire a new accountant in July of last year, and I'm pleased to announce that she did almost the entire financials for December all by herself.
All right.
With just a few questions. So that training is going very well. She's learning and getting up to speed. And we're in a much better place now than we were in July. So that is going well. In the financials, we first reviewed bills. There's a couple things I want to point out to you in those that are kind of unusual. On page 45, there's one that's called Century MERS for $22,590. That is a specific requirement that a previous board requires us to send to our MERS underfunded pension plan. So every year, we have to send an additional above and beyond contribution of $22,590 to that pension plan until which time the plan is 100% funded. So that payment traditionally has happened kind of for the end of the year, the fiscal year. This year, we're trying to get it in there so that it can make money for us faster. And so we moved that payment up to the beginning. So that got made.
Sure, you
And-
talked about this in the past, but what percentage funded is MERS?
Difficult question to answer at this time of year.
As
But
of our-
as of last year, I think it was 92 or 93%.
Okay.
So we've worked really, really hard here to fund that pension plan. And we've made a couple $1 million worth of additional contributions over the last 7 years.
And-
So we are in a pretty good place.
Yeah. That's counting our base contribution and the surplus fund that we have built up in the MERS, where I think we were at that percentage point. If you took the surplus fund out, we're down 78%.
Yeah, that's what I think, 78 without the surplus.
Does that 22.5 go to the surplus or does that go towards the actual?
It goes to the surplus.
And is that a fixed dollar amount or is that a percentage?
It is a fixed dollar amount. It was a contribution. So I can't remember what year it happened, but the board voted to increase our funding, per capita funding. And the increase was $22,590. So they gave us that increase, but then they told us that we had to send it to MERS. So it's a fixed amount of $15,500. And then on page 47, you'll see State of Michigan and the HHS for $417,000. They're wanting some of their money that they overpaid us back. So we have to send their money back. I'm sad we're no longer collecting interest on that money, but I'm glad that they sent it to us and allowed us to babysit it for a while. So if you look at the next page, gotta stop so you can improve that.
Yeah, so I entertain a motion to approve.
So moved.
Support. All right, vote to support. Any further discussion, questions on anything? All right, hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries.
So you got so excited, I tried to move on without you.
See, and I wouldn't even know better, so. Keep going.
So on page 48 is our balance sheet, and you will see on there a big negative number up in the assets of $799,448. That is more money that the state overpaid us, that we've just been hanging on to them and collecting interest. So they will ask for that back. Generally, they want it all back by February. So I expect the other requests will be coming soon for their overpayments and be sending that money back. But until then, it does go up as a negative asset, which is kind of a weird thing to see on a balance sheet.
Question, I'm sure you guys have talked about this too, but what is that tied to anything specific, the overpayment? Or-
It is. So most of our grants that we get are traditionally the grants that we used to get from the state. What we would do is we would spend the money and then either monthly or quarterly, depending on the grant, we'd submit a report through the eGrants system, which is a state system for grant management. We would submit a report and that report would be tied to how much they would send us, and then they would send us the money. Other grants, and specifically some very large COVID grants, they decided that we needed the money right away. We couldn't afford it, and a lot of health departments couldn't afford it, and we couldn't afford back at the beginning of the pandemic to front the money up front. And so they started sending us 1/12 every month. So for example, we got a $600,000 grant to do COVID immunizations last year. And they sent us 1/12 of that $600,000 every month. And we were not spending it. People just weren't interested in COVID immunizations. So we weren't able to spend it. So they kept sending it and we put it in a liability account. and keep track of it
Sure.
so that we know that it's not our money and we don't overspend it. When we collect the interest, and sooner or later they'll ask for it back.
Yep.
So.
Okay, great. Thank you.
Then on page 49, we produce this report every month for you. And it is an in-depth look at where we are based on what we budgeted. So you will see on page 49, all of these programs are over budget from the current budget cycle or what we are currently working on commitment on. And the first one, which is program RU 24, that's the MERS underfunded pension plan. So that's over because we sent them the yearly 22,590. So that'll come back into line as the year progresses. And as you move down the page, there's an explanation for everything that is over. I would be happy to answer any questions for you. We did identify that when I put the budget together, I did not take into effect or account how young and inexperienced our environmental health staff were and how much training that we would have to give them in areas that are programs that generally don't spend a lot of money. So you will see we're significantly over in the swimming pool program. It's a very small program that doesn't require a lot of staff time until we tell everybody, oh, hey, you got to go attend this training. Same thing with EH complaints and body art. You know, we're training staff. We're doing some stuff that is a little outside of what would be normal because we have some inexperienced staff. So some of these programs are going to show over for a while. Some of them will fall back into line as the year progresses. And we will make another budget amendment in May. So some of this stuff is just because I personally guessed wrong. You know, budget is a guess on what you think is going to happen. And I'm not as good at it as Brene was in a previous account. So I would be happy to answer any questions that you have. We are currently 3.81% under.
Questions?
Would move to approve the December 31 month-end financials as presented.
All right, we have a motion with support. Is there any discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? Motion carries. All right, we're up to committee reports. And it looks like finance did not meet. We have programs, policy and appeals.
Program Policy and Appeals Committee did meet on January 15th with Commissioner Leininger and Commissioner Stoll present. At that point in time, St. Joe County had not completed their appointments yet, so you will notice in the minute that it says that Commissioner Baker was not present because at that point in time, he was still technically the other appointed member from St. Joe County to the Board of Health. Our minutes from that meeting are there, and we're going to be taking up a couple of those items that we discussed here later on underneath new business. So I would move to approve the Program Policy and Appeals Committee meeting minutes as presented.
Support. Okay, we have motion with support. Any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. All right, so I don't see anything under unfinished business. So we're up to new business.
So, and if I may, Commissioner, the first
course,
item there, again, is something that was discussed, the Program Policy and Appeals Committee meeting, just adding in there that that we will receive the annual employee satisfaction survey at least 1 month prior to us having to complete the evaluation for the health officer. So I will move the approval of the revised health officer evaluation policy as presented.
Support.
Okay, we have a motion with support. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. Up to the 2025 Board of Health meeting schedule. Was that approved?
It was
yet?
approved in December. We
Okay.
wanted to bring it back now that we have 3 new members. So if it looks good, we can move on, and if not,
Commissioner Schaefer, right now, the Program Policy and Appeals Committee meeting is scheduled for Wednesdays, the days that we meet, and that is at 8:30 in the morning.
Here.
Here.
That's good for me.
Yeah, I mean, obviously I wouldn't be able to make every meeting, but I think would be difficult to have everybody at everything, so.
It
Um,
happens.
the one thing we did talk about briefly at the personnel policy and appeals meeting was coordination of the finance meeting and the policy meeting. I think Becky brought it up that trying to, as much as possible, to get them on the same day, perhaps. I don't know if it's a possibility for people to change meeting dates, but
If there's stomach for that, it would be helpful for us. Mondays can be a problem. That's traditionally when our finance committee meets. But then we do have Martin Luther King's President's Day. It does happen sometimes that has to be changed. So I don't know if there's any stomach for moving finance to Wednesday, mid-morning maybe, or early after, actually might be better early afternoon. I think the room is currently reserved mid-morning.
When are you guys doing yours? It's
We're
Wednesday.
meeting Wednesday mornings, but I think Commissioner Collins, some of those dates would probably conflict with your meetings with,
Michigan Works,
Michigan Works Southeast.
Mhm.
but them only lasts till noon. If we did it mid-afternoon, I mean, I'm talking mid-afternoon, like, I hate doing it 2:30, 3 o'clock, because we even had a big meeting last time and we got done like at 12:05. So, and it's about half
Those
an
are
hour.
primarily in Chelsea. Are you meeting in Chelsea or are you?
No, they're in our primarily. Except for when we have a big one, and it might be in Jackson, when he does I forget what he called it, the consortium. He brings like 2 different groups together, and then there's the bigger place at Jackson together.
Is it big for you guys to have it on that? I mean, are you okay with the way we've been doing it?
We are okay with the way we've been. doing it.
I would say you guys are gonna be really hard to
The
coordinate.
issue I would get into is, like today, here we're always the fourth Thursday of the month.
Mhm.
Our meeting in Brooklyn, our meeting schedule starts the week of the third Monday of the month. So there's routinely, I'll have meetings here in the morning and have to be in Brooklyn in the afternoon, so.
Gotcha.
And if we had another meeting on Wednesday, that just, or.
Yeah.
Mhm.
I'm gonna just throw out a thought of consideration. If it can't work, it can't work, but 9 o'clock works for my family, dropping my kids off to school.
The only problem with that, you're talking about that program policy and field
Yeah,
committee.
yeah.
You guys are right there.
There is the Branch County Collaborative, which is in Hillsdale County, we call it the Hillsdale County Human Services Network, meets in this room at 10 o'clock on that day. So that's kind of why,
Got it.
why 8:30 works a little better for that committee.
just for the, either time works for me, but I get it, the room's in use.
Yeah, sure.
It would just make it tough for me on Wednesday,
To get.
just to get back, especially if the roads were like they were today.
Right.
Right.
I understand.
And
Well, just something we brought
I
up,
really
so,
don't have
yeah.
anything.
Exactly.
sounds like.
Well, and there are, Commissioner Schaefer, I'm sure you know from having served on the board before, and like this month, finance committee meeting was canceled. There will be months where.
Yeah.
We don't need to have a program policy and field committee meeting, so it will be canceled.
I make a motion that we accept the 2025 Board of Health meeting schedule
I don't
as
know
presented.
if it's already been approved.
Oh, so
Adopted,
don't
we're not
need to-
changing.
if we're not
it,
changing it.
probably.
Okay.
So we're not changing.
Perfect.
Good.
All right, so we're gonna move on to personnel policy manual update.
Then again, the commissioners, this was something that was discussed at the program policy and field committee meeting. You'll notice that if you look through the documentation there, where it's red, the items that will be changing. Don't worry so much about the first page or the table of contents pages where it's red. This is just showing with the changes. A lot of times those page numbers will revert back to what they were because this just shows that where it's at on the the proposed document. As we discussed at the Program Policy and Appeals Committee meeting and talking with the state legislator today, could be some legislation moved out of the House today dealing with this issue. But there's no guarantee that that's going to be enacted by the Senate and then presented to the governor for signature before February 21st. So with that said, I would move to approve the updated personnel policy manual to be effective February 21st, 2025. If no other legislation supersedes the current law, just to be effective February 21st, 2025.
Okay, we have motion with support. Is there any discussion on that?
I'm sorry, I missed who's. Thank you.
Commissioner Collins?
And again, as I stated, and let's say that there is some legislation that passes, we still may need to come back and adjust our policy to make sure that we're in compliance with that. But if there is some change to that current statute there, we may not have to make these changes.
And as Rebecca mentioned, the attorneys looked at this and we're not going to be meeting before this potentially takes effect. So we need to get it in place. So any other discussion? All right, hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. Up to Board of Health bylaws.
And we'll grab this one here too.
Yeah, feel free.
As I indicated, we did discuss this at the Program Policy and Appeals Committee meeting. And we did not have it this year because Commissioner Hoffmaster was reappointed by St. Joseph County. But last year, Vice Chairman did not run for re-election from Branch County, and so he was not here. So we added section 4 on page 2 of 3 of the bylaws, adding in some language for if the circumstance would arise where we did not have a returning chair or vice chair of the Board of Health for that organizational meeting, the first meeting of the year, to designate the chair of the Board of Health or the health officer to call the meeting to order and to conduct the meeting through the election of a chairperson. And again, this is just for informational purposes for today, because of the amendment section, Article 9. We will be voting on this at our next Board of Health meeting.
I can't think of a time when we've needed this, but it could have happened this year.
Yeah.
So, I think it's a good ad.
Sure. Good to be prepared. All right, sounds good. All right, we're up to employee recognition.
I stole the thunder already on this one.
Anticlimactic.
Yes, but we do appreciate all of our staff and especially those with monument years.
Yes. Yeah. Yes, we do. All right, so we're up to audit governance letter.
Which we receive every year and it's provided there for you. This is the last year on our contract.
Yes.
What else would you like to say?
So we are gearing up for our single audit that, we're required to have every year. The auditors will actually be on site beginning on Monday, so they'll be here all next week. My team has been sending them documents and uploading the support documents to their portal in preparation for their on-site visit, and we're working back and forth. It's been kind of interesting for me because, I haven't always been so involved in the actual support documentation. My team has handled that in the past. And with training a new accountant, there's a lot of stuff she hasn't learned yet. So I've been a little bit more involved in that. But we're looking forward to having the auditors on site next week. It's always a learning experience for us. We always try to do everything right, and we haven't had any findings in the last few years. But there's always potential to learn something that you didn't know. And so, we look forward to our dialogue with them and working back and forth to make sure that we continue to do things the right way the first time and have clean audits because we want everything to be done right.
Sure. Great.
You said this is the last year of our
Correct.
contract, so you'll also be going out seeking bids for a renewal.
Yep, I'm actually halfway through getting the RFP completed, so I don't have it out yet. I'm hoping to send it out in February, maybe March, later.
How many year contract was that with Painter?
It was a 5-year.
Okay, any other questions on that? All right, so we're up to our second public comment period. If there's anybody that would like to address the board, Tina, you good? Okay.
Mr. Chairman, if you may, you had asked earlier about our pension fund.
I did.
And I'm gonna ask Teresa or the IT department if we can maybe try and get our audit and pension fund separated out and posted somewhere on our website so we don't have to go and review old board packets to find those so that it's just a simple click to maybe look at those. But there's the August 2024 Board of Health packet. And so if you go to, on the Board of Health file, if you go to board document, you have right at the top, there's a spot to see archives. You get to the August 2000
Stuff.
you get the old copies of those, that report from, MERS is in there with the 6.93% valuation that they were using at that point in time, including the surplus fund, our, unfunded secured liability was at funded ratio was 92%. Taking the surplus out, we were at 76%. So
Okay, well, I went back 6 months and reviewed all the board packets, but I actually didn't quite get back that far, so I'll check
Missed
that
that
out. Yeah.
and,
On the resources page, it'll be there in the next 20 minutes.
Okay,
yeah,
thank you.
that's
Teresa.
just something
That's
that
good.
it's a maybe a little easier just to pull that up ourselves or even for the public to be able to see that. So
Mr. Chairman,
Yes, sir.
I don't see an item of members' comments, but I'll jump in under public comment.
Yeah, I was thinking that we should have a spot for that.
I'd like to maybe recommend that we look at changing our agendas for members' time, even if it's just a few brief comments.
Yeah, okay.
But I will say, not only is it good to be back, but I love the page numbers and asterisks.
That's how it's on there for you. Yes.
I encourage that at all the boards that I'm on, please, page numbers and asterisks, motions, so, but good, thank you. for
Yes,
letting
you're
me
welcome.
butt in.
Okay, any other public comment? All right, hearing none, we're up to adjournment.
I would move to adjourn.
Support.
Anyway, motion support to adjourn. All those in favor say aye.
Aye.
Opposed? Okay. We are adjourned.
Rebecca, do you want these from us?